I would like to welcome to our symposium this afternoon Mr. Giovanni La Via, the Chair of the European Parliament's Committee on Environment, Public Health and Food Safety. Mr. La Via, thank you very much for coming.
Here he is.
Very good. You can come up here, and sure, you can join us in the conversation, or if you'd like to say a few words in greeting, please do.
I say hi.
Thank you very much for coming with us. We waste no time in asking you, Mr. La Via, what you think your committee can contribute to the objectives of this symposium. You know the main areas of interest. We've listened to some of your colleagues this morning, and stakeholders, patient groups, the industry is represented here today. You've got a wide range of opinions and feelings, but basically we start from the assumption that you're on their side, and we're very keen to know what you can tell us about the EU's role to help pain treatment, and in particular the European Parliament's contribution. Take a deep breath.
First of all, I want to thank SIP for the invitation. I'm sorry to be late, but we have closed the meeting of our ENVI committee some minutes before, and then we have only run for arriving here, possible in time for having the speech.
Thank you.
I want also to thank for the initiative, because it is important to discuss about pain. We have not, at this stage, pain in the core of our health legislation, and we want and we have to do more. As chair of the ENVI committee, we discuss always about ENVI, but inside and besides ENVI, there is also the healthcare that is, from your point of view, clearly the main political and politically issue important for us, but also important for your society. It is important to give a clear message that we want and we need to do more. I want only to underline that the challenges that the health system are currently facing require the implementation of policies and measures able to increase cost effectiveness and to improve cost containment, while ensuring the sustainability of healthcare systems, safety of patients, and equitable access to high-quality healthcare. The variation in life expectancy across Europe shows the scale of the political challenge we have in front of us. Science and knowledge allow us to narrow the gap in life expectancy, but in order to succeed, we need political commitment, organization, and financing. Financing, it is not the less important, but it is not always and also the more important issue. We need a shift in health policy and in the way we finance, organize, and operate our health systems, with a very strong focus on disease prevention and health promotion, trying to involve and inform more our citizens. I believe that spending on public health can be considered as expenditure. For me, financing health is an important investment that we have to improve. And it is important to underline that until now we have not done enough. The more we invest in prevention and innovation and research now, the less they will pay in treatment costs in the future. It is important to know that pain is not only an underlying element in the health of European citizens, but also a very pressing issue in the quality and sustainability of our healthcare systems. 1 out of 5 Europeans suffers from chronic non-cancer pain. 1 out of 4 is affected by severe chronic pain, especially people that are over 65. And the percentage of people over 65, as you know, is going year after year to increase. From the European Parliament, we will make sure that policy action includes simple but strong measures to support national government in, first, establishing pain as an health indicator and a quality care service indicator. This would result in more accurate evaluation of effectiveness of concrete policy intervention and policy translation of a broader impact of pain in the elderly population. Second, implementing improved mechanisms for exchange and analysis of policy practices across different countries. Third, improving prevention, early intervention, diagnosis and management of chronic pain across all relevant medical specialties and primary care, including the consistent use of existing scientifically validated pain measure tools, improved patient access to innovative therapies, patient involvement in pain care management decision, and access to specialized multidisciplinary medical care terms. Fourth, improving education of healthcare professionals with the involvement of medical professionals from different relevant specialties, patient and healthcare service management bodies. Improved education is probably one of the most important lines, because until now we have not done enough on this subject. Fifth, integrating physical and social rehabilitation as healthcare outcome in the management of healthcare conditions affecting the elderly, namely chronic disease, but also cancer survivors. I'm personally promoting with some colleagues a written declaration on chronic pain, because we believe that today access to treatment, continuity and quality of care, innovation and above all, fairness to elderly patients with chronic pain are still not guaranteed. We will invite the European Commission to propose a directive for the creation of a network of centers of excellence able to ensure competent expertise and access to appropriate care, reducing socioeconomic costs, and provide adequate university trainings dedicated to chronic pain in order to expand the network of expertise and to carry out awareness and patient orientation plans on chronic, not oncologic pain, actively involving pharmacists. To conclude, ladies and gentlemen, I would like to thank you again for this opportunity and for the possibility to exchange our views on these interesting topics. We have here representatives of European institutions involved in the process, industries, associations, and stakeholders. Our presence here clearly testifies our commitment to work for a better regulation and cooperation in order to further develop high-quality and high-efficiency healthcare system and to reach together ambitious goals for our citizens' health. As you know, the Parliament has not the right of proposal, and we have to strongly make pressure together with you on the Commission to make a legislative proposal on this field. Later, we can react, we can add, we can strongly support the proposal of the Commission for having in our healthcare system also a good attention to pain. Thank you very much for your attention.
Well, I think we've seen heads nodding, smiles creasing across the faces of the other members of the panel. So, would you like to perhaps transpose those expressions of satisfaction into a few words to react to what President La Via said? Chris, would you like to say a few words?
I can only just say that's fantastic. That's exactly what we've been working on for years.
Brilliant.
And to hear it so lucidly put is very, very exciting. Thank you so much.
Great. Very good.
Well, maybe if I can add, from the global perspective, the unique situation in Europe is that there is a European Union that can reach out to many governments at the same time. And even, we heard this earlier today, even in fields where it's not the competency of the Commission, by promoting the best practices among countries, I think the term was soft influence, and this can also be maybe even more influential than the so-called hard influence. And I'm very grateful that there's a group of parliamentarians that is taking care of this.
Very good, thanks.
And from the patient perspective?
Yes. I would welcome any action or any solution or possible way to find a solution, and then especially those mentioning of the best practices as kind of benchmark, because that would be for the patients, and considering the cross-border directive, the possibility to get the best possible treatment for their chronic pain condition. And it would mean also a lot of, because we in the Western European countries are more privileged as in the Eastern European countries, so it would give them an opportunity to get also a very fair and good treatment for the chronic pain. So we would welcome that very much.
Very good. Mr. La Via, would you have time to answer a few questions?
Yes.
Yeah?
Sure.
And,
I have one question. In the EU, there's a lot of things are delegated to the national, that's a subsidiarity. Isn't there the danger that healthcare systems, the national healthcare systems say, well, we know how it goes, and then the EU says we want to have it more cross-border and more standardized?
It is clear that the competence of the ENVI committee is a very, very large competence. We discussed this morning about waste. This afternoon we are going to discuss about the healthcare system, and we have also competence on energy labeling or something else different. And on each topic we have to decide from the beginning which is the level of responsibility of the European Union and which is the ones of different member states. On the healthcare system, we know well that we have limited competence in the Treaty for the European Union, and we need to leave to the 28 member states the possibility to implement the system at national level. It is also quite difficult for the European Union to decide and to apply the system in 28 different member states. We are discussing, not today but tomorrow, about, and we are closing the new legislation on medical device. And we know well that there are different experience in 28 different member states, and one of the open points will be for tomorrow the possibility of reuse of medical device, on which there are different experience, because in some member states it is possible to reuse, in others it is not possible. And we are trying to harmonize with little step, and step by step we want to continue in this process for having, in a short term, a good legislation for harmonizing the level of assistance to the patient. This is what we are working on. And then on this field, I think that we need in the future also some exchange in the treaty. But as you know, it is not so easy for the reason that we need the unanimity. And in this period, in the period in which we are many member states against Europe, we are discussing about Brexit, and then it is not so easy to have the unanimity. And then we have to wait for better time.
Thank you very much.
Keep fingers crossed.
Yeah. Any questions from the floor? Who would like to take advantage of this unique opportunity to put a burning question? Or Chris, a comment from Chris? Have you passed them? Thank you very much.
Really just a comment to take back for you. We were just discussing before you came in, we know that it's expensive to treat pain well, but I believe it's cost neutral. We were just talking about the cost of pain to society. And if you really knew the true cost of pain to society, if any of you knew it, you would address it immediately. We got some data on it being 3 to 4% of the gross national product is spent on pain yesterday, and that's a significant sum. But we've got two problems. We've got pain not being managed early enough, which leads to chronicity, and that's wrong. That's very simple to address. And we've also got a lot of money which is spent on pain treatments which just are not effective. So actually, if you change the paradigm, if you looked for prevention, if you looked for rolling out proper, effective treatments only, all this is cost neutral. So it actually, I don't want you to go back and say, these guys want a lot of money. We don't. It can be done cost neutral.
It is quite clear for me for one reason. I'm not a doctor, but I am an economist.
Right. A question from Norbert at the back. Oh, do you want a mic? How can we support you?
How can we support you?
Yes, clear.
Your question.
For the written declaration, it is important your role as stakeholder, because you have to ask to hold the representative in your country to sign the declaration. Because if we are going to reach, as we hope, the majority of the members of the parliament, later the written declaration will be published in an official journal of the European Union, and then the Commission have to react and have to make some proposal. We know well that in the past was easier to reach the majority. Today we have a lot of written declaration, and we need to stimulate all the members of the parliament to sign. You have to do this kind of job. Find your representative in your country, in your region, and ask them to sign the written declaration. It is not so easy to have the majority of the parliament.
Thank you very much. So your contribution to our meeting is not only inspirational, but practical. So thank you very much.
Thank you very much.